Welcome to EJB Talks, Rutgers Blaustein School experts in policy, planning, and health, where we talk with our faculty and staff experts, as well as students, about how the fields of public policy, urban planning, public health, health administration, and public and urban informatics affect your lives. Welcome to EJB Talks. I'm Stuart Shapiro, the Associate Dean of the Faculty at the Blaustein School. And the purpose of this podcast is to talk with my colleagues and our alumni about policy, planning, and health, the interaction between these issues, and how they affect people in New Jersey, the United States, and the world. As you know, we're talking to our new faculty to start our second season. Today I'm speaking with Professor Sumitra Bhuyan, who, like last week's guest, Susan Crum, teaches in our relatively new but quickly growing health administration program. Professor Bhuyan also now holds the distinction of being our first repeat guest. Professor Bhuyan, welcome back.
Thank you, Stuart.
When we talked in the spring, we were talking mostly about the pandemic and the effect on hospitals. It was obviously a crazy time. Today, I want to focus a little more on your area of interest, your area that you research, and that's cybersecurity in hospitals. How did you get interested in this?
So hi again, Stuart. It is good to be with you again this morning. So one of my, as you said, one of my main research areas actually in health information technology. So specifically to understand how different HIT applications are empowering our patients and also our healthcare providers to meet the triple aim, that is mainly improving patient outcome, reducing healthcare costs, and improving the health of the population. So, as you might know, we spend about 18% of our GDP in healthcare, and it's continuously going up. So, with this rate, it is unsustainable. We need to find a way how we better manage our health, better manage other system to and integrate the different systems like the hospitals, nursing home, and other healthcare providers. So that's basically kind of that's the reason I was interested in how health information technology will impact and affect um, and uh, and and the US hospital system or the healthcare system has always some kind of computerized system to collect the patient data and for billing purpose or for storing the data. But it was after 2009 actually the hospital started to share the patient data across different providers, and that was happened because in 2009 that as a part of the American the Recovery Act, the high tech bill was passed, and the hospitals got about in and around $30 billion to adopt and use certified electronic health record system so that they can meaningfully use those systems to improve patient outcome. And the good thing is that increasing number of hospital after 2009 adopted and used using certified electronic health record system, but the data breaches, the number of data breaches and hacking incident went up significantly in last 15 years or so. So another problem with the healthcare sector is if you really think about our financial institutes, they basically spend around 15% of their operating budget in IT, in health, in information technology, and in healthcare we spend in and around 5% of the operating budget in IT. So we spend significantly, as a part of the operating budget resources in the IT. And as a result of that, we make our system vulnerable to outside attacks. And that has a lot of implications for patient safety and data privacy. And in last year after the COVID pandemic, there are some opportunist attacks, cyber attacks increase, mainly attacking hospital research organizations and health agencies. And the trend is increasing every year.
So, if let me sort of distill this a little bit, there's obviously tremendous advantages to increasing the information technology presence in our healthcare systems. There's cost savings, there's efficiency, and hopefully there's better care. But that comes with a risk. Can you talk a little bit more about the risk and the kind of threats that exist as a result of this increased movement online?
So basically, as you might have noticed, cybersecurity is not, or cybersecurity breaches are not only issues in healthcare, but in overall in our lives, right? From how we vote in our elections, how we shop online. I think there are always concern about these data breaches, cybersecurity issues. Actually, last year there was a report from IBM Security and Ponemon Institute. They found that there was about 130% increase in the number of data breaches from 2006 to 2019. That's all our sectors, not only healthcare. And but the cost of average data breach in healthcare is significantly higher than other industries. It's about 65% higher. For example, in 2006, a data breach cost about $3 million. Cost of compromise record, and in 2019 it actually went up to about $8 million per, not per breach but per incident of data breach. And if you really break it down by the sector, it is highest in healthcare. So we spend about more than $400, 429 precisely, for each record of each breach of record in healthcare. And the second is the financial institute, about $200. And then the mean is around $150. So it is also increasing in terms of how much we need to spend once the breach occur. um, and after the SSN, the social security number information, the healthcare data is second most valued in the black market when they go and sell these data. And also think about that healthcare is a very sensitive environment to work in, right? Think about, there is a ransomware attack. You are practicing in an ED or emergency room, and all of a sudden you say that you cannot get access to the system if you don't pay a certain amount of money to the hackers. So the question is what you'll do, because there is a patient for you to you're taking care of a patient, and they are kind of demanding money so that they can, you can get your data back. So a lot of, the hackers take advantage of this sensitivity of this healthcare data. Actually, they exploit this vulnerability, and that is why there's more interest in healthcare than other fields. But there is also, it's not only about, hacking this data, but there was a study from Israel. They found that they did a study actually. So they found that the attacker can use deep learning to add or remove evidence of medical condition from medical scan. So they did a study. So what they did is that they actually introduced fake cancer notes in CT scan, and it was created by a malware, and then tricked the radiologist to think that these patients have cancer actually when they did not have. So it is, and think about the implication of this kind of incident, right? We are in a political kind of election is coming. So think about how this kind of information can actually affect someone's political career, right? And again, it can also sabotage research we are conducting in the universities. What if they kind of introduce a certain thing, and also it can lead to the insurance fraud. Maybe it can also lead to murder. So it's really kind of evolving. And healthcare is kind of the number one target for a lot of these hackers.
So this is all very terrifying. It's a some of the examples you've listed are definitely things to be scared of. How realistic is it, and can you give some examples, particularly from around here in New Jersey, of hacking episodes in the healthcare sector?
So it is actually it's not a specific. So it about 94% of the healthcare system has experienced. That's the data suggests some sort of cyber attack. And between 2009 and 14, about 150 million patient record were breached. That's the number we have, and it is continuing to actually go up. For example, in 2019, the healthcare data breaches almost triple as compared to 2018. And we don't have the data yet from 2020, but I'm expecting the number will go up again. So there was two incidents actually from New Jersey last, I would say, last actually about 9-10 months in December of 2019. Hackensack Meridian Health, they paid actually a ransom to the hackers to stop hospital cyber attack. We don't know much about the case, but the news was released that they pay that ransom to get the data back. And recently, actually, this is the news from last week. The University Hospital in Newark, they paid about $670,000 for as ransom to get back their data. They actually or prevent the hackers to publishing about 240 GB worth of data and about 48,000 documents, including patient medical record. So it is the New Jersey hospitals, they're facing this problem, but I think this is a problem across the country. Very recently, University of California San Francisco, they paid about 1.4 million dollars to decrypt the files that the school determined important for some academic research work they were doing. So their system was not infected, the patient care side of it, but the academic side of it, where they conduct this research, that was impacted. So they paid that 1.14 million dollar there to kind of get the system back. So this is kind of a growing problem across.
So now that you've scared us, it's time to give us a little hope here. What can hospitals do about these threats that you've outlined?
So uh, so so before even I go into that, I just want to talk a little bit about so what kind of threats are exist, right? That's important for us to understand before we go in terms of what the hospitals can do actually mitigate some of these. So the cyber threats comes in different flavor. While we largely focus, we think that somebody sitting in a remote part of the world having access to our database remotely, and kind of attacking it. But sometimes we really overlook the physical security of our system. That is the foundation. So it is interesting. Actually, I do have a guest speaker in my I taught a health IT class before. I had a speaker. He is a security analyst, hired by hospital to do their risk assessment. Once a hospital actually hired him to do their risk assessment, and he actually looked into the Facebook, and found that the CEO actually attended a football game, and he was actually wearing his badge, and he actually got the information from that badge, and he basically copied it and got access to their system. So basically, I think that's one very important thing. Sometimes we really overlook the physical security, of our healthcare system.
I mean, the
And
weakest link in a cyber system is often a person.
right, the weakest is a behavioral issue, not the technical issue. I think it's more a behavioral issue. And you are as strong as your weakest link.
Right.
So once your weakest link is exposed, you are vulnerable. So basically, And think about that, think about that, what the cyber attacker can really do. They can actually copy these ID cards, and healthcare is a very stressful environment. You go to a hospital and you pretend to be a part of the IT team, and somebody need to solve a problem. More very likely they will let you enter if they see that you fit to the culture, to the environment. And that's not my assumption, but that's the reality. And once you get into a floor or a department, you can have access to so much data. And think about, I think, we all understand, right? Think about how many username and password we have in our lives, right? It's very difficult. And more likely those healthcare provider are going to write those password and username. You'll find it somewhere around their system. Either they're kind of using a sticky note they'll put on the computer monitor, or you'll find it below that the keyboard. So it's very easy for them to have access. And once they get access to that, they are in the system. So that's one physical security aspect. The another one is basically the fear of somebody sitting somewhere else and introducing some kind of virus to our system. So one of the reason why the country moved towards electronic health record system, so one of the strong proponent was the providers, because provider thought that they can have access to the patient record at any time, and they can actually see that from their home, from their workplace, anywhere you say. So what happened as a result of that, there is a growing culture called bring your own device. So you have your device and you have access to the patient information on your iPhone. So that also add a layer of complexity, because you go home, for example, your child want to play with your phone, and accidentally that your child download a certain software to your phone, right? And then software actually can have access to that patient record system. So that's how the hackers can get access to the actual network. So that's another issue. But um, and if you really think about what we need to do as a system, as a healthcare system, we need to actually work on the culture of how we can actually prevent the cyber attack, because the culture of security is not there. As you said, people really think this as a technical problem, but more so this is actually, it's not a purely technical problem. Somebody actually said that if you think technology can solve your security problems, then you don't understand the problems, and you don't understand the technology. So I think having that, the culture of security is very important. Culture of security, how we actually live in a punitive world. So the people who might accidentally made some mistake, they may not come out and kind of say that, oh, I make this mistake, and trying to cover up, they lead to more severe breaches.
So, so the solutions then are in our management systems and in our culture creation within hospitals.
Yes, that is, I think, one aspect of it. And there are a lot of others, like training, and then come up with comprehensive policies. For example, what you're going to do if your system get breached, right? If you cannot access to the patient medical record, what is your backup plan? I think those also need to be developed. But I think the one very important part of it, and again, I think we need to reevaluate it, because the telemedicine is becoming a central mode of healthcare delivery in this country during COVID, and going forward, I think that the telemedicine will gain more traction. So we really need to understand, create the sense of culture about security. I think that's really important. But there are some other steps the healthcare system must take to ensure the security of their system. As I said, the physical security, think about the frontline stuff. The frontline stuff, that the incentive is not there for them, and they are not a part of the overall security assessment they do. Mostly it's the providers, and the non-clinicians like nurses, providers including physician and nurses. But I think we need to develop a plan that is right, that cut across the organization, not just the clinicians, not just the provider.
Right. And hopefully, I can assume this is the kind of stuff you're teaching our students in the health administration program.
So yes, we do basically. I'm not really teaching the health IT class, but when we teach the strategy part, we talked about health IT. It's not a separate issue. It should be a part of your overall organizational strategy. And it should reflect on your strategic plan, on your budget, and you need to allocate resources to make sure that the system is in place to make sure that if something happened, you can actually react. And um, also you can make sure that everybody in your team is competent to deal with that. And actually we published one paper recently where the title was how we can move the healthcare system to be more proactive rather than reactive to the cyber breaches. So far, the health systems are reactive. It just, we'll see what happens if we get breached. Right? That's the culture right now. So I think we need to change the mindset from let's see what will happen if we get breached to more proactive, that what we can do to make sure that our system don't get breached. But having said that, it can get breached at any time. So there is always that fear.
I don't think that reactive slash proactive distinction is unique to healthcare by any means. Professor Bouillon, thank you very much for coming on. It's been a very instructive session. I know I learned a lot.
Absolutely. Thank you so much, Stuart.
Also, a big thank you to our production team, Amy Cobb and Karen Olson. We'll be back next week with another talk from another expert at the Blaustein School. Until then, stay safe.